his big
Stars
somewhere over the rainbow and
Yeah,
Star Search.
yeah,
you
yeah,
know?
he does. Yeah, as he
It's
should.
great.
I look back at
great.
old pictures of him when he was on, and it was a while ago. It was in the 80s. Yeah.
Oh, I know. It was in the 80s, and everybody had that awesome Patrick Swayze mullet.
Yeah, he did.
Big old, everyone did. Oh, it's great. But we could talk about hair for hours, but what we should be talking about is breakthroughs in the trans community that's happening around in our country. And we're so happy and thrilled to have Dr. Loren Schechter, Medical Director at the Center for Gender Confirmation Surgery at Weiss Memorial Hospital with us. Dr. Schechter, welcome to the show.
Hi, thank you for having me, and my pronouns are he and him.
Thank you.
Thank you. Mine are he and him as well. Ellen, your pronouns are?
She and her.
There we go. And thank you for starting off that way. Dr. Schechter, when did you first become an activist and an ally for trans medical rights?
Well, I've been caring for transgender individuals for over 20 years now, and it's really been a natural evolution in my career. Probably, well, I would say going back to probably about 2005 or 2006, I was asked to get involved with assisting an incarcerated individual with access to gender-affirming care. Subsequent to that, I've been involved in a number of cases at the federal level, which try to expand access to care for transgender and gender-diverse individuals, mostly pertaining to surgery. I've also had the privilege and the honor to be a discussant at the Pentagon back in 2017 during the reconsideration of the Obama-era policy of allowing individuals with trans experience to serve in the military.
Oh, is that all? It's very impressive. And maybe you could talk with us to our listeners about some of the obstacles and barriers that trans individuals sometimes face throughout the country. Because I know with the last administration, for some hateful reason, they were particularly going after the trans community when it comes to just even homeless shelters, let alone when it comes to seeking medical care. What have been some of the barriers that were put in place during the previous administration, and as we are looking ahead, what do we feel the promise is with this new administration?
Well, thank you, and thank you for allowing me to speak and discuss the topic. I think probably dating back now about 10 or 12 years, we saw significant improvement in terms of access to care. Of course, the Affordable Care Act was instrumental in doing that. Also in 2014, when Medicare overturned its decades-old policy of excluding coverage and reimbursement for gender-affirming care, those were some real watershed moments in expanding access to care. Subsequent to that, and certainly over the last few years, we've seen some pullback on that. We've seen efforts made to limit access to medically necessary care. And let me say that while not all individuals with trans experience seek surgical options, for those who do and for those who are good surgical candidates, gender-affirming surgery is safe, it's effective, and it's medically necessary. We've seen efforts by the previous administration to not only limit access in terms of insurance coverage or third-party coverage, but also remove various protections that serve to protect individuals with trans experience from discrimination. And, I think that even in the first 100 hours or so of the current administration, we're seeing some important rollbacks in that attitude.
Absolutely. And I love the fact that you are definitely qualifying that gender confirmation surgery is a medical necessity, which I think can be a controversial term for some people. why do you qualify it as it is a medically necessary procedure?
Sure. So for some individuals who are diagnosed with gender dysphoria, and gender dysphoria refers to the stress, the anxiety, the distress associated with the incongruence between one's identity and their physical morphology, their body. Gender dysphoria is a medical diagnosis, and there's medical treatments for that. As it has long been said, adjusting the mind to the body, what we often now call conversion therapy, is ineffective and, in fact, unfortunately illegal in many states and in many countries.
Thankfully.
But thankfully, and for individuals who experience dysphoria and do not achieve either relief of dysphoria with non-surgical means or elect to undergo surgical interventions, it is a medically necessary intervention. You know, we often conflate cosmetic surgery with, or I should say elective surgery with cosmetic surgery. While there may be cosmetic interventions that any person elects to undergo, many gender-affirming surgical and medical interventions are medically necessary.
Dr. Schechter, so many children today, I'm finding, which is a good thing due to more examples and people being more honest and the world changing. I'm seeing more young people, and I mean young people. We've had kids as young as, Scott, we had like a 5-year-old, 6-year-olds on the show and up. More kids are realizing that it's okay to be who they feel their true self is. And where do you stand, though, on at what point, what age, what point do you feel that it is safe and reasonable for someone to go under confirmation surgery?
Sure. So, very, very good question. Let me just say, even taking it out of the realm of children for a moment, there's no necessarily right or wrong way. This is these are individualized treatments. These are decisions between individuals and their physicians and their healthcare professionals. So there's not necessarily a recipe. But having said that, generally speaking, there are no medical or surgical interventions for children. We begin considering interventions, whether medical or surgical, once an individual reaches adolescence, and that may start with access to what are called puberty blockers or pubertal suppression medications. Those are medications that can prevent or delay the development of secondary sexual characteristics, for example, breast growth or growth of the Adam's apple, and so on. So when individuals enter adolescence, they begin to demonstrate the first signs of puberty, and perhaps for them that intensifies their dysphoria. They may begin with medication to slow, block, or delay their puberty. At that point, we may begin considering surgical interventions. In adolescence, the most common intervention would be what we refer to as chest surgery or top surgery. That refers to mastectomies or removal of breast tissue. Generally speaking, individuals begin accessing those interventions perhaps around the age of 16 or 17, on the early side, occasionally 15. In some circumstances, a bit earlier, but that's about the earliest time we begin surgical intervention.
And I love that you are also stressing the point that these decisions they're extremely personal, and some people who are living the trans experience do not choose to go that route. I know I have a friend whose child recently came out, and when she first got her hormones dosage, she said that she felt like, oh, this is the norm. This is how I'm supposed to feel. So they're just like every person, every trans individual is an individual, and all of these choices are not necessarily across the board. Dr. Schechter, we are on the precipice of making history right now with Dr. Rachel Levine, who has been Biden's nomination to be the assistant Secretary of Health at the Department of Health and Human Services. What are your thoughts on that?
Well, I think again, if we look back and kind of describe some of those watershed moments, the Affordable Care Act, the removal of the Medicare ban, I think this is very likely, as we look back in history, this will be another watershed moment. For many individuals, Dr. Levine, who I have had the pleasure of meeting, I don't know her well, but have had the pleasure of meeting. Not only is she a very talented and intelligent individual and has been serving in an important role in Pennsylvania, I think her visibility will be helpful for many individuals. I think having role models and allowing not only young individuals but adolescents as well as adults know or sense that breaking down these barriers, diminishing and decreasing and hopefully eliminating stigmatization is very helpful. It's very helpful for mental health, integrating into society. So I think this is a very positive step.
Absolutely.
It's a positive step for all communities, especially for folks who say that they've never met a trans individual or know who this is. Now we have somebody who is wicked smart. Everybody keeps talking about the fact that she is a trans individual, but they're also overlooking the fact that she's really smart and super duper qualified, and she's been doing this this job in Pennsylvania, and there's been nothing but praise on her performance with the COVID pandemic within the state of Pennsylvania. So not only do we get to have somebody who is smart to help us overcome this, we now have somebody that we can see like, oh look, trans people are amazing individuals and
great role models.
Great role models for everyone.
Well, I think, I think your comment, we often hear that, well, I've never met a trans individual, as we hear people say, I think I get a little kick out of that because they're probably wrong. And in fact, they probably have met trans individuals and probably more than one. They may simply not recognize or know that.
Absolutely. Well, Dr. Loren Schechter, thank you so much for joining us today and shining some light on these important issues. And we hope you have a fantastic day and look forward to all of the wonderful things that you do.
Thank you very much. It's been a pleasure to speak with you both.
Thank you, Doctor.
All right, thank you,
Keep
Dr.
up the great
Schechter.
work. Thank you.
Yep,